This is the Sports Medicine and Athletic Training Workshop for 2024 as mandated by the SSAC and Department of Education. Specific goals for today include concussion, cardiac heat updates, as well as pre-event meetings, i.e. the medical timeout meetings. Make sure that you have documented your attendance to this video. There are forms that you will find on the SSAC website. There is an information sheet that you will need to complete, along with a verification form that administrator will sign for you. And then if I need to send you a verification sheet for HR at the board office, you'll need to send me an email and I can send that to you and verify that you viewed the video. Physical forms were revised in May of 2023. Make sure you're using the current ones. The past in-person sessions that we did, we found a number of schools that were using older versions. Please don't use them. The 23 added mental health information questions, and there were several deletions on the physical itself per recommendations of our medical board. And then there are 3 pages of information for parents and athletes, including head, heart, and heat. Remember that all of this information is personal health information, so do not share it. Keep it protected, but make sure you have access to the forms once the administrators have checked in people to make sure that you know the medical information in case there is an emergency, if they use an EpiPen, etc. We'll discuss the concussion report a little bit later, but there's also a report on high school football injuries. This year, we are doing just those that are season ending and those that involved EMS transport. Definitely game coverage is included on these so that we can follow our practitioners and the level of coverage with games with EMS. But the 2 big items include if it was season ending or if it was by transport, emergency transport. These come directly to me. If you would use the Martin_D1 at wvwc.edu, that would be greatly appreciated. Again, Martin_D1 at wesleyan.edu. For those that have used the forms before, they've essentially not changed, just decreased the number of lines with concussion since that's online, and then this spells out EMS transport, or if you know it was season ending. Just to let you know from 23, the reports that we got. So this is just reported on reports received. 54 of the 113 high schools submitted reports from 23. They reported 10 EMS transports, almost all of them for games or scrimmages. 63% injuries games, 37 practice, more lower extremity than upper extremity, and then a variety of other injuries. There were a couple of internal injuries, asthma, there was a heat. Again, this year, EMS transport, and if it was season. The dates, and by the time you're looking at this, we're already into this week. We're already down into this. The end of this week will be scrimmages, and then on the 26th, first contests. What type of coverage is in West Virginia? As reported by the schools and people attending the workshops last year, licensed athletic trainers was 53 out of the 113 schools, state certified 7, and 53 limited. Level of coverage by school classification, so that is whether it was all seasons, all school year. Some coverage, it could be maybe just home basketball games or just tournaments, and then if it was just football only. And we can see as far as all year coverage goes, 38 schools covered all year, and then the others had some, and a large majority just basically cover football. Safe Sports Schools, the National Athletic Trainer Association will not get us a list until after August the 15th. And we would strongly encourage schools that have full-time coverage by a licensed athletic trainer to apply for the Safe Sports School Award. There is financing available through the West Virginia Athletic Trainers Association and the Mid-Atlantic, i.e. District 3. And any questions, you can let me know, and we'll get you connected with the right people. All right, what are the current policies? What's the law say? What's going on? So the first thing is Department of Ed policy. There has to be an athletic trainer to serve during football practices and games, grades 9 through 12. Recommended for middle school, but it's general requirement for 9 through 12. You may be a student support certificate for AT, which we term state certified, which goes back to pre-2011. Athletic trainer authorization is those that are licensed athletic trainers and are to use the initials LAT, ATC. And then if the school cannot hire either one of those categories, then it goes to a limited sports trainer. The term was changed from limited football trainer, so it's a limited sports trainer. You have to be a licensed healthcare provider, so it runs the gamut from physical therapist to EMT, paramedic, RNs, etc. And then also within the mandate is mandatory update workshops. All right, some of the additional details on these with various practice acts and using terms. Remember that LAT ATCs are licensed. There is a practice act in West Virginia concerning licensing of athletic trainers. So be very careful using that term. If you are a licensed athletic trainer, which would be nationally certified and then licensed in West Virginia, you must post your license at your place of employment. That's the quote. So that means it needs to be posted on the wall in your athletic training facility so that individuals can see it. It needs to be readily available. For other folks, you may not use the term. You have to be very careful using the term. I'm the athletic trainer, I'm certified, I'm any of those type terms, any of the abbreviations. Don't use LAT, LST, LFT. The only one that's acceptable is the LAT if you're licensed, so please be careful using those terms. And remember, if you are operating as a limited, remember that your standard of practice, your practice act, comes into play with your skills. All right, additionally, management of concussions goes back to 13. Licensing then was athletic training. Management of concussions updated and revised in 19. Sudden Cardiac Arrest Prevention Act in 19. This has since been superseded by Senate Bill 602 in 24. In addition, additional cardiac is AED has to be readily available. Effective fall of 21, CPR training for all sport personnel, so all your coaching staff have to be CPR AED trained by the fall of 21. And then here's the Senate Bill 602 that was passed on March 1, signed by the governor, and came into effect May 30, 24. And the next couple of slides will have details on these. Again, this is an update of the previous one, but nevertheless, there's a couple of changes and it emphasizes a couple of things. So you have to have an emergency response plan. You have to have a cardiac emergency response plan, i.e. your EAP, and could be included, it is included as part of the emergency action plan at the SSAC, but this has gotten renewed emphasis. And then the word practice the plan on a regular basis was put into this. Again, it reiterated all coaches have to be trained. And one of the changes is not just the handouts that are part of the physical, that are included on the SSAC website, but that there has to be an informational meeting. All sports, so every sport, which details warning signs of sudden cardiac arrest and recognition, sharing the EAP. The EAP's got to be posted on the school's website. And then parents, guardians, and signatures of students must be included. These records are maintained at the school. So that's definitely a change, not just the information handed out, but an actual information meeting. And that can be done in part of preseason meetings, which you all have anyway. Then the National Federation Sudden Cardiac Arrest video, which is on the SSAC website, that just reiterated that. That's been required for several years now. And then a re-emphasis on that any student exhibiting syncope or fainting before, during, and after an athletic activity is to be withheld and referred to a physician, nurse practitioner, nurse specialist, or physician assistant. EAPs have to be worked in conjunction with the emergency medical services that are local, and that reemphasize that the AED is on site for all practices and contests, not where you have to run off the field somewhere to get it, but that it's physically on site and ready to go immediately. And just as a sidebar, please check batteries and replace as needed. All right, concussions and head injuries. Again, parents are to receive information on concussions. Coaches have to do the concussion course. And then anything that looks like appears to be a concussion, when in doubt, sit them out. All it takes is one sign and done. Then this starts, you'll need to do a concussion report, and then return to play criteria comes into play. Remember, each step is 24 hours minimum. You'll see the information here in just a second. Again, this particular law and policies require emergency action plan, and it's for every sport venue. Here's what the emergency action plan looks like from the SSAC on the web page, and you can see right here in the center is the CPR AED plan, getting the AED, etc. There's heat stroke, etc. on here, but make sure this is the minimum. If yours is infinitely more detailed, that's fine, as long as you've got a plan in place and it's reviewed on a regular basis. Concussion report. For those that have done this before, the report has not changed. Remember that you may add other if it's related to physical education class, fight, falling out of a tree stand, whatever, because that does impact your workload in the team. Details, and this is an expanding line, who initially evaluated in details is expanding, so you can go longhand and provide more details. Specific steps from light aerobic exercise to return to play. This is mapped out, and then who cleared. Remember, these documents on clearance belong to the school, and make sure you keep records of who cleared the athlete and make sure it includes the date of injury and the date that they were cleared. And then when you submit the reports, send means complete, save means you're going to edit. And when you do a save, you'll get an email back with a direct link to your concussion report. Please do not send and then have to start another report and then a third report and then a fourth, because we've had several. That happens every year several times, and we have to figure out, is that one injury or is it re-injuries? But send, complete, save, edit. And really appreciate getting these, because when asked by legislators, etc., then we can provide some information on concussions that are reported, and at least people know that they're being recognized, and we have some information to go on to encourage continued coverage for our teams. So concussions reported 23-24, 240 football, and then another 220 in other sports. And I just did a quick breakdown. High school, 75 out of 124 schools reported. Please, we need this to be increased. When we've got coverage at 113 football schools, then please report concussions. Middle schools, 38 out of 162 schools reported. In middle school, it's much harder on reports because there's only a half a dozen athletic trainers that are covering, um, the middle schools, so it's harder to get reports, and it falls on the administration. But definitely appreciate getting the reports. So to do a review, remember that any traumatic brain injury that results in any disruption of any kind, remember that is a concussion. Don't use terms like dings, bell ringers, etc. And remember, they don't have to lose consciousness. They can be lightheaded, dizzy, etc., and they don't have to be unconscious. So any type of mechanism, and then you have some form of an injury of some type, sign or symptom, then it is a concussion. So it could be any of these signs and symptoms. So they could be anywhere from dazed, foggy, to can't remember events either after or prior to the game. May not, be able to recall dinner, pregame meal prior to the game that evening. Any type of headache, dizziness, blurry vision, sensitivity to noise, light, any of those kinds of things. And it's basically one of these and you're out, one and done. All right, moving on. To reemphasize from multiple sources, when in doubt, sit them out. Don't take chances. No return to activity on the same day of concussion. And then if you're having symptoms, period, you're not returning. So this could be a week, this could be a month, and you may not even be able to start the return to play protocol. That's up to the clinician that's doing that. But remember, no return to activity until they are cleared, and definitely no return the same day of concussion. Definitely want to mention second impact syndrome. Second impact means exactly what it says. They had a concussion and then have not recovered. And then there's a second impact, a second hit, and that really disrupts the neurosystem within the brain. And this is potentially lethal. Massive amounts of swelling can occur extremely quickly, and all of the nervous system within the brain is thrown out of whack. And this is absolutely devastating, and we don't want to see any of these anymore. Post-concussion syndrome, just as a review of any of the signs or symptoms that somebody could have. In this age group, they tend to recover within 1 to 2 years. Let's try that again, within 1 to 2 weeks. And that includes the college athletes as well. And will do fine. But there are others that could last quite a bit longer. And we need to just be aware of that if any of these continue, they could be post-concussion. Every once in a while, we will see somebody that lasts a rather long time. We did have a couple last year. One in particular I remember from football who was not cleared for any of the winter sports, and he was finally cleared for baseball. So at several months later was still having symptoms over Christmas, New Year's break, and was not cleared until baseball. All right, just as a reminder, a normal CT does not equal no concussion. CTs and MRIs, X-rays show structure, so they are looking at fractures, acute bleeds, which you hope you don't find, but you need that test to rule it out. But that doesn't eliminate whether it's a concussion or not. Those tests do not see concussion. The concussion goes back to your signs, symptoms, complaints, that the athlete has. Evaluation, just making a note in here, your evaluation and what forms you use are your choice. It's based on the school, it's based on your team physician, etc. But you choose what evaluation forms you wish to use. This is just a partial list. There's some others that will show up later. Some of you all may be using the most recent one. Others might be using SCAT 5. SCAT 5 is on the website, and so are these. There is a current update for those of us that are licensed to bring out additional information to bridge from SCAT 5 to SCAT 6 and updated information where procedures are changing and recommendations are changing with concussions. So I'll leave this up here about 10 more seconds or so if you wish to get that information. There is an open access document available through the Athletic Trainers Association to where you can look at that bridge statement. All right. Your decision if you have a concussion in one of your athletes and you're on game field or practice field, it's your call. Do you send them straight to the emergency room? Do you call parents? Do you allow them to stay till the end of the half? That's your call. It's based on their signs and symptoms, complaints. If it's a game, many times it'll be based on what parents want to do. If they want to take them, then they're on their way to the ED. But you make that decision, but no choice. You got to get them out of there if things are getting worse or they start to have seizures, nausea and vomiting, increasing confusion, speech, vision issues. Then get them out of there. That means they have got to go. All right. General treatment notes. Be very careful with all anti-inflammatories and narcotics. We don't need to wake them every 1 to 2 hours. You're probably going to have to be careful with diet for a day or two. And then the note down here is rest is not to be prolonged. Short amount of rest, and within 24, 48 hours, then should be starting back on things and beginning to have more activity. And remember that there's a return to learn process and a return to play process. And if they cannot return to learn and can't be in the classroom, then obviously they do not get cleared for the field. Now, the other thing is please monitor vitals. Pretty standard EMS protocol. You do vital trending. Please monitor vitals in someone who's had a head injury and pay attention to what the pulse ox is doing, plus the pulse rate and the blood pressure. How are the numbers changing? And trend them. If you're going for a transport, EMS by all means should want to know what vitals you had and whether it was 10 minutes ago or 20 minutes ago, but that needs to be shared and they need to be asking for it and take it to the ED. Blood pressure cuff matters. Please make sure that everybody in their kits covering high school has a regular adult size BP cuff as well as a large adult BP cuff. When we have linemen that are standing 6'6" and weigh 300 plus, a regular size cuff will result in an artificially high blood pressure reading. It will read high. So using the correct size cuff makes a lot of difference. There was a major article and several press releases last year from the American College of Cardiology along with some other groups to emphasize the importance of taking blood pressure correctly, which meant the right size cuff. Protocol is here. This has been revised on SCAT 6. That is your clinician's preference and protocol that they wish to use the SCAT 6 because there's some subgroups on here. But your clinician who will be doing the clearing, or if you're doing the clearing, it is their call or your call, whether you're using SCAT 5 or SCAT 6. This is what's currently on the website. The Sports Medicine Committee will be meeting come spring of 25, and this will be one of the things that will be reviewed. The following 7 classifications are those that are licensed to evaluate and then release to return to play with our athletes with concussions. All right, and then I threw this slide in, and it generates discussion when I'm in person, but I just put this slide in to emphasize good and bad. So it is good that somebody's got control of the head and neck. This is very appropriate, and they're initiating an evaluation. But since this is in the middle of the day, pen lights are totally useless. Remember, just cover their eyes and then uncover. And as the sun hits their eye, then watch for pupil reaction. All right, preseason testing, i.e. your baselines, and then post-concussion. We mentioned post-concussion a couple of slides ago, but on both of these, this is your choice. It could be your choice yourself. It could be your medical direction. It could be administrative directive. It is your choice on forms, some of the additional forms that are utilized. Remember, it is your choice, whether it's your individual choice, your medical director, your administrative directors, which could be the local school, it could be the school board itself. But you elect to use whichever. We just follow it on your information form so that we have an idea what is being used. Not everybody does baseline, and it does vary on these forms that are used. All right, the Sudden Cardiac Prevention Act. Um, and again, we talked about this earlier. Uh, and just a couple of notes. That's the original. The updated is 602. And then this was developed in conjunction with the Department of Health and Human Resources, which is now Department of Health, on the handout and the information. But what I want to add in here is suspect sudden cardiac arrest in the age group we work with. So this is basically our middle school through college age. If somebody in that age group goes down, they collapse, unresponsive, and they have a seizure, so it's called a sentinel seizure, and it could be just lower extremities only. It could be just right side. But if there's any type of seizure, don't think neuro first unless you know that they have seizures, but do not think neuro first. Think cardiac first. So go right for vitals, checking pulse, checking responsiveness, and then move on activating your EAP and getting CPR started and getting the AED. And again, readily available. That it needs to be attached within 3 minutes. It needs to be readily available and ready to be attached and activated. All right, there have been several grants over the past several years that the SSAC has been able to coordinate. So in 22, there were a number of AEDs delivered at the schools. Most of them were, this brand is Philips. So they are blue inside a red case. Make sure that the electrodes are okay. The Philips happen to have a long life battery, but just check your expiration dates. So that's inside the case. And then again, need to emphasize they're not to be mounted inside the building where you got to run in and get it. These are portable devices, and they need to be on the sidelines for all practices and games. And in many circumstances around the state, when EMS rolls in on a game, they will have an AED in the rig as well. So you should have, most cases, have 2 on the field, if not 3. All right, now we move to the environmental stuff. So the things that we deal with here is lightning. And then in the center, that sky high number is heat related. And numbers should be significantly higher this year with the amount of heat we had. Last year was bad enough, but this year is proving to be worse in the general population. So most everybody's going to be familiar and just want to reemphasize exertional heat stress. that we need to acclimatize. That's why there was a calendar posted earlier on this video. You need to have water readily available. There needs to be rest periods, and then you need to know about heavy individuals or possible sickle cell trait. And then if there's any question whatsoever, or it appears that they're having heat stress, then intervention needs to be as rapidly as possible. So here's the heat policy, and there'll be a couple more slides related to that. So the policy applies to all practices and conditioning activities. So basically, this is whether it's in season, out of season, summer, parentheses, flex days, and it's all sports, both indoor and outdoor. And then you need to be aware of, as well as the coaches need to be aware of, if somebody is at particular risk for exertional heat illness. Monitoring must be done utilizing a wet bulb globe thermometer. This device was provided to the schools, okay, here, and along with additional AEDs and water tubs. So mandatory use. The records have to be kept at the school. So you keep your records. It doesn't matter how you keep the records. You can keep them digitally. You can keep a paper log, whatever you want to do. It's your choice. But please keep a record that you have taken the readings, and you continuously monitor when they're on the field. And this device helps to calculate for not just temperature and humidity, but shade, wind, etc. All right, and here's the guidelines. So, and again, this is available on the website in several locations between the sports medicine section and the individual sports. It's underneath the football section. But make sure you're following these guidelines. All right. Now, before we move into the treatment side of things, remember for game situations, this is handled differently, that you want to use common sense, but remember in a contest, officials control the game. So you make sure if it's hot and humid and the wet bulb is high pre-game, then maybe ask the officials to adjust the kickoff. So kickoff at 7:30 or 8 o'clock. If during the game the heat doesn't settle down and the humidity goes up because of our terrain in this state, then you let the officials know that we're moving into a little bit danger territory, and they will decide. They can do official timeouts. They can also come back and recommend, okay, everybody get helmets off, extra water break. But they dictate those. You just stay in contact with the officials and let them know that we're still in a pretty hot environment. Can we work out something appropriate to help the kids cool down and get some extra water? Now, if exertional heat stroke is suspected, the standard of care today is cool immediately, and the best thing is ice water immersion. And then this could be in a tub, stock tank, kiddie pool, whatever. And temperature range between 35 and 58 is what's recommended. Usually I like to stay around the 50, 55. But continue to add ice as the ice melts and continue to cool them. Monitor vitals. And this is protocol in some areas of the country, like the Phoenix area. This was in the news last year, how aggressively they were treating their residents between fire and EMS and then the local hospital. Fire and EMS in Phoenix, they utilized the TARP method and put people in it. They empty water coolers, ice chests, which are carried on all of the first U engine companies in the city, and EMS is prepared for that as well. They can start IVs, monitor temperature, and there are dedicated treatment rooms at the ED. So most of them try to get referred to this healthcare center, but they have rooms already set up with water-filled container and so that they can cool the person off, and they have a pretty good record of saves. Water tubs were provided in 22 as well. And if you can't find this one or don't have it available, or if it becomes pretty awkward to get it between fields, you still can't beat a good old traditional kiddie pool. Kiddie pools have been used by a number of agencies for the past 40 years, even the military with training camps, because they're easy to move, they're easy to fill up, blow up, and then collapse them and get them off the field. But whatever, so that you have readily available mechanism to get them in the water, cold water, and get them cooled off as rapidly as possible. Okay, here's the traditional cooling, and here's the tarp assisted cooling oscillation, or TACO. Tarps, of course, can be bought at Home Depot, Lowe's, and other places. And just get a tarp, easy to transport, fold it up, doesn't take up any room, and then throw it out, get the person in the center of it, and get the sides supported. On goes water, on goes ice. Someone is at the head, maintaining the head in a stabilized manner, and just gently oscillate, rock back and forth to keep that water cooling, and then add more ice to it and monitor their vitals and get them cooled. Now, updates. The West Virginia Department of Health, the Emergency Medical Services Division, has issued new sports medicine guidelines, GL 011, dated 2024. I just got this copy a week ago. So they specifically talk about medical timeout, and they are directed to make contact with the providers on the football field or arena, etc., and to look at what's available, who's available, what the procedures are, as well as there are specific things that they dealt with heat related, and we'll deal a little more with the medical timeout in just a second. But in their protocols, anyone with exertional heat stroke must be cooled first and then transported. So basically read this: if you have started cooling, which you should have, they are to assist you with the cooling. They are to monitor vitals. If their protocols call for IVs, they will start those. There may be other medications used, but they have protocols to follow up to and including 15 minutes and monitoring the vitals, etc., and then transport. It's not load and go. It is cool first. There is also a long list that's included in a document on what is to be done in pre-game checklist or pre-venue meetings or medical timeout. So we'll leave this here for a few more seconds just so that you can look at it. And then band is to be included with this as well. Band directors are to follow the same guidelines as far as heat, lighting, etc. All right, I'm going to talk about lightning safety now. And remember that when thunder is heard, whether lightning is seen or not, doesn't matter. And if lightning is seen, then we're going for the 30-minute rule. You're out. If you have your lightning detector, set it at the 10-mile rule. You can make it more sensitive by going to 12-mile rule, which detects lightning further out. You cannot decrease it like, well, we'll just shift it to 5 miles or 8 miles. No, that's not sensitive enough. That doesn't offer enough protection. It's the 10-mile rule. All right, now let's look at the medical timeout. Remember, this is just to emphasize all parties need to be involved. So medical staff, EMS, police, administrators, etc. And there's the pregame checklist again from the other slide. And if you wish, It is open access. If you wish to use what's called medical timeout, and the form will be in the next slide. But remember that athletic trainers are responsible for the meeting. Go to EMS, or EMS should be looking for you. And then if no AT is available, it's the head coach's responsibility unless the athletic director takes care of it. But you may use, this is proprietary, developed by Dr. Jim Kyle. It is open access. I'll leave this up here for a few seconds, so if you wish to write it down, Kyle-group, and it's multiple pages, not just one page, but lots of details on it. But work out your hand signals, how you will wave EMS to the field. EMS should already have protocols on landing zones, but they need to know which gate to use, etc. Do they drive onto the field? Do you let them take the rig onto the field, or is it stretcher on and then the stretcher goes off? But work through those protocols. And also, please, as part of this, if you're the host to the visiting team, you go over, introduce yourself, let them know what you have available. If you have your team physician on the sideline, if they need additional ice, to let you know. And if you're the visitor and go to a place and nobody's introduced themselves to you, I walk across and I want to know who's available. Can I get extra ice, extra water, etc. But please communicate with each other. All right, just as a note, backboards are not the standard of care in most cases, so follow whatever the EMS is saying that they're going to do. So more times than not, it can be a C-collar only, and then they're secured to the stretcher. All right, a couple of additional notes and we'll get finished up. Make sure you know if anybody has an insulin pump or an inhaler. The information should be available if the officials ask about it. You don't need to have printed records and hand it to the official for every contest, but you need to be able to answer a question, why is Billy or Sally constantly coming out? Well, they happen to be a severe asthmatic and it's really humid tonight, so they're using their inhaler. All right, quick review. Required online courses. This is required for the coaches. So concussion every year, cardiac every year, heat first time they coach. If you are providing trainer coverage and have not looked at these, please look at these, because then you know exactly what the coaches have seen, what they're looking at, and that would also help you be aware of policies and procedures. All right, hopefully you will have a safe fall, certainly hoping for it. Just remember to follow good hand hygiene and OSHA guidelines. And then I'll leave this up here for about 30 seconds or a minute so that you can get an email address. The email address is not case sensitive, martin_d1@wvwc.edu. Office number, SSAC office number, on like your football report. If you would send it to my email address, that would be greatly appreciated. And again, if you have any questions, you can call either my number and leave me a message, or you can send me an email, or you can call the SSAC office. Thank you for your attention, but also thank you for your willingness to help take care of our athletes within the state of West Virginia. Thank you and have a safe fall.